Okay, this is a short topic on urinary retention. So regardless of the cause of the patient's urinary retention, whether there's a cause by a stone, in the bladder, urethral stricture, for instance, or any mechanical obstruction, let's say um, Samuel has a enlarged prostate, for instance, or a tumor in his bladder, regardless again, which one is blocked, the ureters are blocked by another, let's say polycystic kidney disease. Okay. So any condition that causes obstruction of any structures leading to from the bladder going out causes urinary retention. Now, consequences can be disastrous. Let's go straight to the, here are again the causes. Okay, so I mentioned a few. So any obstruction caused by structures in and around between the bladder and the urethral opening. So a few examples here are trauma. I mentioned the stones, a tumor, or even pregnancy. Okay, pressing on the bladder can lead to specific serious complications. So here are a few. So complications can be AKI, yeah? Or which type? Which category? Pre-renal, intrarenal, or post-renal? Post-renal AKI. So that could be one. Others are pyelonephritis, because can it lead to a UTI? Yeah, urinary retention can lead to a UTI, and then the UTI could become pyelonephritis, and then further sepsis. Now, it could also be hydronephrosis. Now, we haven't talked about hydronephrosis yet. What is hydronephrosis? This is a condition when the urine that's supposed to be coming out already, meaning it technically left the kidneys. Yeah, it already went down to the bladder. But now, because of the obstruction, the urine backed up, returned to the kidneys. Now, that should not be happening. Urine is supposed to come out, leave. That's why the urine, that's why the kidneys made that urine, because we were meant to eliminate it. We didn't need that. So now the urine went back to the kidneys. So once they drown the kidneys, we call that condition hydronephrosis. In order for that to happen, though, there has to be hydroureter first. So if you look at the picture here, so this is what we're dealing with. So the patient has both. You can't just have hydronephrosis without having hydroureter. They always go together, because can one happen without the other? No. So this is an illustration. So here, look at this is a normal ureter. Look at this ureter now. So it dilated. So it didn't happen, um, easily, meaning there has to be significant retention for this urine to backflow. And then once you have hydroureter, and then now you'll have hydronephrosis. This can lead to chronic kidney disease. So unless we drain that urine promptly, the only way to drain this, because it's not easy to relieve the obstruction. Sometimes it may be just a stone, then the patient will have lithotripsy, either laser or shockwave or cystoscopy. Okay, we go invasively, put a scope in there, and then retrieve or destroy the stones. Okay, so it's not that easy. Let's say the problem is more serious than that. Then that means we'll have to drain the urine straight from the kidneys. So it will be invasive. The patient will go to interventional radiology, and then they will, with ultrasound guidance, they make a small incision in your retroperitoneum, then insert a tube straight into your kidney to drain the urine. So now the urine can't come out here. So now it has to come out through a catheter on your flank area, and then it will go into a bag. Okay, so instead of peeing here, you just go to the toilet and then drain the bag. Okay. Yes.
Is that like a one-time process or?
Depends on the underlying cause. If it's cancer, then it'll take probably longer. Or sometimes, right.
They might have to do it numerous times.
Well, they actually leave the nephrostomy tube in there for as long as possible. They can exchange the tubes if they either get too old or if the tubes sometimes get obstructed. Okay, so they can exchange the tube. Okay, so some people will have this permanently. Depends really on how did they get this condition in the first place. So if it's a tumor or some other difficult to treat cause, then, or sometimes it's permanent. Let's say the patient doesn't have a bladder anymore, right? So that could be an option. Mhm. No, you can't have both urostomy and nephrostomy tube.
Also, it's either.
No, it's either one. Okay. All right, any question? That's about it. So the important thing here is, do we allow this to happen in the first place? No, we should have noted already the urinary retention. Of course, we can't do anything if the patient was at home. Okay, but if a patient is in an institution, a hospital, or a nursing home, is there a reason for this to happen, really? No, we should be assessing our patients. Okay, so don't you wonder, oh, why hasn't this patient peed? No, and then it's 2 shifts already. Is that normal? No, you should be aware of your patient's intake and output. Yeah, you should be, especially if they're in an institution. I mean, they're not going anywhere. Right? Right. Okay, so watch, and then promptly report any change in the urinary output. Okay, because the kidneys are very sensitive.
Psychiatric patient, observe that sometimes we have to do the fact, right? I want to know if it's them telling themselves that they can't do anything. Like they're so sick in their head, like they're holding their urine. And then you have to like do a cat in order to do it.
What's the question?
Like, how is it? Does it, because you said it occurs by your UTI and these other causes, but can it be caused by
Yeah, absolutely. Yeah.
mental?
Yeah, it happens to Parkinson's disease patients, spinal cord injury patients. But again, we should have known that, this should not have happened. Okay. I mean, I'm talking if the patient is in an institution, of
Yeah.
course, right? So they're at home, and we have no control what they do or not do at home.
So these institutions